Well, June is Men's Health Month, and we are here at Performance Medicine in Johnson City, joined by our daytime doc, Dr. Tom Rogers, to talk more about men's health. And of course, knowing you like I do, I know that is one of the things that you focus on all year round.
Right. You know, I like to be known as a men's health specialist. I'm a 61-year-old man who kind of knows what's going to happen. And I see patterns, but one thing we've done through the years is partner up with the Tennessee Men's Health Network. Mike Leventhal is also a good friend, patient, and colleague for many years. We visited the White House together this winter and had a great time at the first Men's Health Initiative. But Mike has partnered up and been a great spokesman for the whole state and really nationwide. So I wanted to bring him to kind of help us kick off June.
Well, thank you, Dr. Rogers. Dr. Rogers is on our medical board of advisors, and we're very grateful for your support all throughout the years. And you were actually our 2013 Doctor of the Year, so don't want to leave that out as well. But Men's Health Month started back in 1994 with an awareness period called Men's Health Week, the week leading up to Father's Day. And we like to use that as an opportunity for guys to learn more about their health and to schedule that important appointment with their physician. Many times guys don't like going to the doctor, but it's imperative that we do at least once a year. And that's when I met Dr. Rogers. I met Dr. Rogers during Men's Health Week back in 2012. I hadn't been to the doctor in about a year, and so when I met Dr. Rogers as a men's health specialist, I thought, here's my doctor. And he's been my doctor. I've been his patient ever since. And feeling great and encouraging all men to go see the doctor, especially a specialist who understands our specific health conditions.
And you've said that over and over again, that men are not really particular fans of going to the doctor. You have to kind of give them a little push.
That's a tough thing about men. You know, they feel macho, we feel macho, and we don't need help. But when actually, you know, the rates of a lot of diseases, certainly death, cigarette smoking, alcohol abuse, suicides, is much higher in men than in women. That's one thing we worked on at the White House this winter. But so men really need that first step to get in and to see a doctor. Hopefully their wife or their loved ones will encourage that. But men, there's a lot of stuff you can do for prevention. And that's what we're all about, is optimizing your health and preventing disease.
And what are some of the key issues that men face as they get older? Some of the things that I know that your office sees quite a bit.
Well, of course, we always screen for prostate cancer, and also we see a lot of low testosterone levels. We've dealt with that for years, and it's controversial, but when you look at it and study it and travel all over the country and have experience with it, I can tell you testosterone does not cause heart disease or prostate cancer. In fact, you're much more likely to get those two if you have a low testosterone. Plus, men come in here and they're tired, they're depressed, they may have lowered libido, and they can't, you know, work out like they did. So they need a thorough evaluation of their testosterone levels and safe, effective replacement.
So, Mike, I guess you're saying, too, if you can't remember the last time you've been to the doctor as a man, now is the time to make that appointment.
Right. We want to use June as that time to schedule the appointment with your doctor. And as Dr. Rogers said, I work across the state. Many men that I've encountered have told me that when they have had hormone replacement therapy, testosterone replacement therapy, it's changed their life. So I would encourage all men to know their numbers: cholesterol, PSA, blood pressure, weight, and testosterone levels. It's important for good quality of life.
It is important. Well, we thank you so much for joining us, Mike. We're going to give everybody your website if you would like more information. And of course, for Performance Medicine, you can always check out their website as well. That one's right here, performancemedicine.net.
The preceding portion of Daytime was sponsored by